Nairobi, Kenya, city of many so-called informal settlements. One of these settlements is Sinai. PharmAccess aims to connect more people to better quality healthcare in places like Sinai. One way to do so is support local clinics. The better these clinics are run, the better they serve their patients. Most patients in these clinics pay in cash, and this has disadvantages. Let's hear what the director of Access Afya clinics in Sinai has to say about that.
So one of our challenges with cash payments is it does actually take time and money to bank cash. And then, we're honestly concerned about our care providers. So we have people inside of our clinics that we really want to think as we grow about how to protect as best as possible.
So in cooperation with the Access Afya clinics, PharmAccess set out to get an answer to this question. Is it possible and useful to have completely cashless clinics?
For the system to really work, we equipped the clinic with a Lipa na M-Pesa till. The clinic was very supportive in that they said that from that point onwards, nobody would pay using cash, they would pay using Lipa na M-Pesa. So for us as PharmAccess, we positioned an agent there to really just explain the new concept to patients and of course excite them about the chance of winning 1,000 shillings worth of airtime weekly. We also put in an M-Pesa agent into the clinics. All clients who would come, they would be required to deposit money through the agent and pay using the digital platform.
But what do patients think about it?
It was a good idea because you're a patient, you are sick, you're carrying money. Anything can come from outside, then the money can get lost.
Many patients thought the same. 89% of patients thought it was a good or a very good idea. 94% thought it was likely or very likely that they will pay by M-Pesa again. 46% paid with their own phone. The rest did not bring one and got assistance from the M-Pesa agent. Deposit costs went down from 1,200 to 66 shillings, and deposit time from 90 to 5 minutes. The clinic saw a revenue increase of 30%. The causes of this increase are to be determined.
In our next steps, we want to see what kind of incentives can we introduce to promote digital payments, of course working with additional clinics and also exploring the issue of a reduction in administrative costs, a reduction in leakages, because some clinics really report very high rates of leakages, and we want to see would digital payments really change this.
So now we know, yes, it's possible to have cashless clinics. We'll do the research that still needs to be done, and we'll do everything we can to make it work.